Yeah, so today we are going to discuss about the diseases. So before going with disease, let me tell you about the blood pressure, what actually normal blood pressure is. So as we pump out the blood from the aorta will move all around the body, will go into our body. So the pressure exerted on the blood on wall of the blood vessel. So that is known as normal blood pressure. What the pressure exerted by blood on wall of blood vessel. Now you can see the as in the blood vessel there is high, we can say, blood. So this means the blood will also exert somehow pressure. So the pressure which is exerted by the blood on the walls of the blood vessels. So that is pressure is known as normal blood pressure. Now as we have arteries, veins, capillaries, so which contain more blood pressure, where we can say blood pressure is high. We have what artery, veins, capillaries, and third we have arteries. So here the question arises, which we can say contain the high blood pressure, sorry. So this means कि now remember that arteries contain the more blood pressure. So this will be arteries have the higher blood pressure than capillaries. Then capillaries have the higher blood pressure than the veins. So the least blood pressure which is in the veins. Now why the artery contain more blood pressure? So because of the arteries, the pressure in the artery during ventriculation systole. Whenever the ventriculation systole take place, which we have discussed in our heart previous videos, ventriculation systole means ventriculation construction. When the ventriculation systole take place or ventriculation system take place, what will happen? 120 mm of Hg divided by 80 mm of Hg. Here we have, sorry, system, not systole. However, here we have system. So here you can see this 120 mm of Hg divided by 80 mm of Hg, which is basically present in the ventricular system. This is present in the systolic when ventricular are contracted, systolic, and this is present in the diastolic when ventricular are relaxed or diastole. Fine. I hope till that it is clear to you. So that's why the blood pressure in the arteries is higher. So mostly we measure the blood pressure in the arteries. As you can see, many of person, if they want to check their blood pressure, so the person got injected on their arms, because of in the arms we have what arteries, and arteries contain more blood pressure. So this is what mostly blood pressure we measure blood in arteries. Measure in arteries. Fine. So now let me tell you about the high blood pressure. High blood pressure is basically one type of disease. So let's see about the hypertension, which is high blood pressure. Hypertension, which is high blood pressure. So in the high blood pressure, so what is the blood pressure of the systolic? So blood pressure of the systolic is become basically 140 mm of Hg. As the normal systolic we have 120, so it become 140, and we can say diastolic will become 90 mm of Hg. So when a person went to the doctor and the doctor checked the blood pressure, if the blood pressure is 140 mm of Hg divided by 90 mm of Hg, so this means that person is hypertension. This means that person have high blood pressure, or the blood can be more than that, so that person is hypertension. That person have high blood pressure. Hyper hypertension. Fine. So now you can see what this is basically the normal situation it occurs, but if the person is not serious or if the person did not get to treat it, so it can be serious. Okay, it is basically the common, it is common, but it can be serious, it can go in the serious condition when person will not treated, serious when person will not treated. Person is not treated. Fine. So this is what here in the hypertension there is no symptoms occur, people do not feel any symptoms, so that's why, so kindly go and check the blood pressure in few months. Okay, so person do not feel any symptoms in this condition, no symptoms occur. Fine. So this is the one disease which is hypertension. Now let's move with the another disease, that is CAD, and that disease is known as basically, that disease is known as coronary artery disease. CAD. This disease is basically what? This disease is coronary artery disease. Coronary artery disease. Fine, so let's discuss about the coronary artery disease. So coronary artery, now first of all you might have the concept of coronary artery. What is coronary artery? Coronary artery is basically the artery which supply the oxygen to the heart. Artery which supply oxygen to the heart. To heart. Fine, so this is the artery which supply oxygen to the heart. So for suppose if this coronary artery is blocked or there is the narrowing of the lumen which is and the coronary artery, if that lumen become narrow, so this means that disease is known as CAD, coronary artery disease. Okay, what will happen here? If coronary artery got blocked or narrowing of lumen, the lumen become narrow of the coronary artery. So that disease is called as CAD, or CAD disease is also known as athero atherosclerosis. Okay, remember this name. Mostly this question is asked. So why the coronary artery basically block? Now this is the question. Why coronary artery mostly blocked? So coronary artery blocked just because there is one thing which is pelvic. I don't remember the pronunciation of this. So this pelvic, this means this pelvic can be either we can say cholesterol, calcium or lipid or anything. If this pelvic is basically increase in the coronary artery, so this becomes, that's why if it is increase in CA coronary artery, so this means what, the this will do the narrowing of coronary artery, and the narrowing of coronary artery cause a disease that is CAD or atherosclerosis. So I have the all both diseases are clear to you and the basic concept of blood pressure. So till that, bye bye.